I have problems with anxiety and depression, and since being here I've been diagnosed bipolar 2. I talked to them on the phone, and I came in to take a little tour of the place, and they told me about how everything works, and I was sort of in a place where I needed something like this, so I decided to go for it. Really friendly people. Everyone was super nice and super friendly, so I just kind of, I didn't have time to shop around because I just needed somewhere to go. Round the clock supervision, 3 meals a day, bed to sleep in, support groups, and a therapist and a psychiatrist. That sort of varies depending on my mood. I think overall it's been a really positive experience, and I'm glad that I came here, and I feel like I have got stabilized, and I've learned some short-term coping skills, which I'm very happy about. It's a beautiful house in a beautiful neighborhood. It's great. I feel like we're sort of the black sheep on the block, but it's good for us. My therapist, Stephanie, is amazing. She's like, I feel like I've made a best friend. Because I've had other therapists before, and I just feel very fortunate. And, I get to see her twice a week, and we've really dug really deep into some stuff, and that's been really, I'm really happy about that. I hadn't done group therapy before I got here, and I was sort of skeptical. I just thought it was going to be a bunch of people complaining all the time, and I was, it's a lot different than that. It's the same group of guys that meet at every group, more or less, and we really develop a camaraderie, and we know each other better than the therapists know us, and there's just really some amazing things that happen sometimes. I don't know, some of the therapists I think are really great. I think Bipolar is really great. I think Natalie is really great. We have an anger management group that I've gotten some really good work done in. We also had a sex and intimacy group that I've got some really good work done in. We've had some outings, we went to Mulligan's, and that was a blast. I got to go on a go-kart, which I'd never done before. I couldn't figure out why my go-kart stopped, and then I realized my foot was on the brake. We played laser tag and mini golf. And we went to the beach, and we played frisbee, and we swam in the ocean, and those were sort of my favorite activities. We get up at 6:30, and we take our meds and we breathalyze. And then Monday, Wednesday, Friday we go to the gym. We leave at 7:15, and we get back at 8:30. We have 45 minutes at the gym, but it takes 15 minutes to get there and back. And so we get back at 8:30, and then we eat breakfast, and we do our chore. We have a chore list, and we make our beds, and we do anything else we need to do, and then we leave for the center at about 9:30, 9:45-ish, and then we get to the center at 10, and then we have a meditation group first thing. Every morning we have meditation, I really like that. I've really learned a lot from meditation. And then we have groups. We have the schedule of different kinds of groups. We have process groups, and we have psychoeducational groups, and we have, various things, and then we get back we have lunch. We have more groups, and then somewhere in there we see our therapist 2 days a week, and we see the psychiatrist if we need to, we see the doctor if we need to, and we see the nurse if we have problems, and So we get back from the center at about 5, and then Monday, Wednesday, Friday we have mandatory groups. So, so I've been happy about that. So we go to meetings in the evening, and I go to this Depression Anonymous group at the Share Center that I really like, because it's usually a small group of about 5 or 6 people from the community that are there. And again, they're sort of regular people, and I've got to know them, and it's nice because they're a little older, and they have a different perspective, and also they're there voluntarily. The groups that, the support groups that we go to in the evening, people can choose what group they go to at the Share Center. So the only people that are in my meeting are the people who want to be there. So I like those meetings, and then we come home, and we can watch TV. TV goes off at 10, and we have to be in our bed at 10:30 on weekdays. So that's the routine. It's a good schedule. Just stick yourself to a schedule. I can tell that their priority is to make sure that we don't hurt ourselves. And they've really, they were very thorough about that. And I appreciate that they have my safety in mind. They also make sure that we don't have access to drugs and alcohol and things that are going to, the things that we're trying to stay away from, the reasons that we're here, including, for the first couple of weeks they take away your electronics, and that was a major problem for me. So I'm glad that I was forced to live without my electronics, and they've got the things here that we need. They've got therapists, they've got psychiatrists and doctors and a nurse. All the resources are here. People are in the building. I've learned how to cope with anxiety in the short term. I'm able to intervene now because, learning about sort of these cognitive biases that I have, it's sort of held up a mirror to my own thoughts, and I'm able to catch myself in these. And my therapist has me doing these affirmations, which first I thought were just kind of a waste of time, but I realized that they are actually having an effect on my thoughts, and I'm able to forgive myself for my mistakes. I'm able to sort of stop this sort of feeding into the anxiety of, rather than just letting myself ruminate and letting myself dwell on something, I'm able to sort of intervene and set a different path into motion. So that's good. People coming here have such a wide variety of issues. My sort of tip would be to be thorough and to do your homework.